the smart surgeon that knows which one is a good candidate for a knee replacement and which one is
Which one isn't? Yeah, that's right. Right.
that's where the money is. That's
Yeah.
where the meat is. The
Yeah.
actual replacing the knee is wonderful because you can walk again, but knowing who's not going to be a good candidate for a knee replacement and who is and who's ready is what makes an excellent surgeon versus an average surgeon.
Yeah.
And people
That's right.
don't understand that because it's very nuanced. I have a couple of more questions. I love the way you think. Do you know much about Paragon think tank in DC?
No.
I wonder if you knew them. And what do you think about Bill Cassidy, the senator from Louisiana? I think he has some good proposals as to how to benefit primary care providers within the system that is broken. At least he's thinking outside the box and cost and how do you change a cost curve.
Now, Cassidy, is he done? Is he finished?
No, he's got to run.
Got 2 more years?
He's got 2 more years. He
Yeah, I
runs
heard
a
he wasn't
J.
going to run again.
I don't. I understand that the I don't know if the attorney general, someone in Louisiana, is going to run a primary against them.
Okay.
But
Okay.
he's got some good ideas. I've heard him in some when he.
I do go to those terrible PAC meetings, and
No,
I was with him and Dr. Marshall, senator out of Kansas, last year in Sarasota, and listened to them both talk about it. As you may know, Senator Marshall is buddy with Bernie. And I got to hear Marshall and Cassidy talk about different primary care options. They're big proponents of DPC, which I like. I even think some people say it doesn't work at scale, and I probably argue against that. I think it works fine at scale. I don't see any employers that are in all 50 states that can't make it work. And if they can't, then just go, you're just doing it wrong because it's totally a scalable enterprise. I think that you've got a lot of challenges in primary care. I'm not sure why we're not incentivizing more docs that way. What do you think?
the problem is that you have to go back into history. So Medicare was a program that was built to keep what they called elderly back then.
Yep,
62-year-olds because life expectancy was 65
that's right.
out of dying in the streets because they couldn't access care
Yeah,
and they were dying from heart disease, cancer. And so the money, rightly so, just like they did with the COVID vaccine, was put for innovation and hospital care to keep you at the end of life from dying in the street.
yeah,
And so they pay a lot for MRI machines, they pay a lot for the Da Vinci robot, they pay a lot for the ultrasound, for ICU care. All these things were not around in the 1960s. CT
right.
scanners, it's because the US government decided to pay a lot for these things so that people would innovate. And what have we seen is that there is no longer people in their 60s dying in the streets of Chicago because they can't access care. And if they do get cancer, they get phenomenal care. Even
Mhm.
the poorest person gets phenomenal care. But we're only spending 4.5% of the 5 trillion in primary care.
That's right.
And we haven't been able to pivot to 50% of the patients are seen in their primary care office. We can't just pay that workforce 4.5% of the bucket.
And why this gets me into a conversation about the RUC committee, right? The RUC guys. Why does CMS task these guys? I think there's 30 or 32. I have an interview with one of them in a couple of weeks, one of the members of the RUC committee. But they keep lowering the amount of reimbursement that non-surgical docs get. And then I've never seen an increase since 1997 of the residency cap budget. And so why is it that way? I just don't, because my brain doesn't logically understand why we don't want more primary care docs. I think it's one of the hardest and most challenging jobs in all of medicine.
I think people want them. It's just it's a budgetary problem.
Yeah.
There is no more money, and the people that make the money, and it's a pediatrician is lucky if they make 200 grand a year.
Yeah.
Okay. But A radiologist right now can work 2 weeks out of 2 weeks on, 2 weeks off, 6-hour days remotely, never leaving their house, and they make 450. So twice as much as a pediatrician, but they have 26 week off a year.
Yeah. No, that's
And
true.
so they have money and they have time to protect their turf. And the primary care doctor, I have friends who take 1 week of vacation a year
That's
and
insane.
go to the office 5 days a week to see kids, and they're barely making 150,000 after 25, 30 years in practice.
This is why, though, this is
And,
why we
so
have to,
you think that person's gonna, where is he gonna get the money to donate to a PAC, let
yeah,
alone travel to Sarasota, Florida,